Hello, this is Robert Rickover. I'm an Alexander Technique teacher in Lincoln, Nebraska. I also teach in Toronto. My guest today is Eileen Troberman, an Alexander Technique teacher in the San Diego area. And we've been exploring the whole question of sitting at a computer, especially for someone like myself, who's had a spinal surgery, a spinal fusion between C3 and T2, so pretty major fusion. And the what we've been working with is, okay, you're sitting at a computer and there's certain things you might want to do, like get your head a little closer to the screen, that sort of stuff. How can you do that in a way that doesn't put undue strain on the junctions of the fusion and the spine? And while it's especially useful for people who've had that kind of surgery, I think it's also pretty useful for anybody. So Eileen, take it away.
Okay, so what we're going to do is play around with the so many varied times where we end up wanting to see something a little more closely on the screen.
Mm-hmm.
And people do this when they're looking, even when they're looking down on the keyboard or looking normally at the computer. But where our attention goes, that's where our head and body go. And so because we're going that way, our head and body tend to press down that way a little bit. And particularly our neck as well as our head tightening a little bit and shortening of our spine, but our neck, we end up bending from this area of our neck when we want to, what is that on it? So we end up putting this pressure
How's
in.
this like what we're talking about?
Yeah, or even like looking down towards the bottom of the screen or something, how this bends here. Don't do it, we don't need to do it too much, but that kind of pressing
Yeah,
down in here
yeah,
that people do, this comes forward. And a lot of people
right.
call it head forward because your neck comes forward. But
Mm-hmm.
and it is a compression, but we have a lot of mobility and we can do that. But if you've had a fusion in that area in the top of your thoracic spine, we don't want to put a lot of extra pressure on that. And normally we wouldn't want to put so much separate pressure on that area also, even though it's part of our flexibility. But
Mm-hmm.
instead, so if I'm going to look at the computer screen is here,
Mm-hmm.
and I'm going to look at the computer screen. If I'm going to look closely to see where's that little thing I click on or something, you'll see that this area here, see how that easily presses a little forward and down to get closer. Even though I'm
Yep.
tilting forward from my hips, we still like, oh, wait, what is that? And in doing this, my spine's fairly straight doing this, but it still puts a lot of pressure here. And
Right.
I end up even going more forward from here because this is kind of the mobile place to do that.
Mm-hmm.
So to take pressure off of that, there's a way instead that I can let my lumbar spine be free. So that if I want to think, well, where is that little thing I want to click on? Huh. Without tightening and using muscles to arch my lumbar spine, I can use the fluidity of that freedom in the lumbar spine to change my hips and legs.
Like this.
Yes, exactly. Yeah, and if you put one hand on your lower belly, as if you know, sort of hand on your lower belly and one hand on along the vertebra of your lumbar spine,
Mm-hmm.
you'll feel when you do that, you can kind of just feel the roll of your belly, and you'll almost feel like your knees kind of shoot forward through the, even though your legs are staying where they are on the seat, it's like the bones go forward through that.
Mm-hmm.
So
Mm-hmm.
there's just that freedom, and it's not one where you're purposely tightening and arching. That would be this. It's
Right.
just the freedom of our lumbar spine, and that actually can, without actually sliding on the chair like this,
Mm-hmm.
it can it can glide a little bit, almost like it glides, your bones glide through the skin to let that tip. And it's a wonderful way to use the freedom in your lumbar spine for
Mm-hmm.
when you want to get close to the computer. And there's lots of other reasons that's really useful, because that area right between right where our lumbar spine meets our thoracic spine, right in here,
Mhm.
it's an especially nice free mobile area. It's where
Mhm.
our psoas starts, where our diaphragm is attached. There's so much going on through this area. But there's
Mhm.
also just a lot of ease and freedom, like there is for the rest of your spine, but there's a really nice juncture change where your spine and your rib cage come together. That lets your whole lower body move a little differently. So, what I'd like you to do is to stand up and let's
Mhm.
play around with this standing. So,
Okay. So,
yeah,
all
that's
right. I'll tilt it down a little. There we go.
good.
Okay.
Yeah. So, what we're going to do is we're going to do a little movement that really is through your ankles, knees, hips, and lumbar spine here. And it's not that this is held still here. It's just
Mhm.
that movement, as everything eases and lengthens and expands, that movement is mainly from your lumbar spine on down. You can see where I'm not losing height, so I'm not doing
Yeah. Well,
this.
I'm doing that right now, and I can see from looking
Yeah,
at
that's
my head on the that I'm not getting lower in height, but I am
yeah.
moving a
And it's
bit
a
down.
tiny movement. It's just a little. It's not like
Right.
a big movement forward and back because your whole
Right.
body would tilt that way. But it just is sort of a swing of your trunk from the lumbar spine down. And
Mm-hmm.
again, it's not where you hold above that. It's just a little freedom in that swing, which we can do, and a lot of people don't really know about it. So again, if you put your fingers on your lumbar spine, so
Mm-hmm.
like a row along the
Mm-hmm.
vertebra,
Mm-hmm.
you'll feel when you do that, you can feel the lower vertebra moving more than the upper vertebra in this. They're swinging a little bit more. So you could even feel how that's swinging in your body again as you come back
Mm-hmm.
to the ease of your neck
Mm-hmm.
and the ease of your, yes, there you go. Yeah. So it really, in a way, it enlivens the lower abdomen. It's not a tightening of the lower abdomen. It's not using the abdominals like this, because then I get shorter
Mm-hmm.
doing
Mm-hmm.
it. But it's just that little freedom of your trunk, a nice little swing on the lumbar spine that's part of our
Mm-hmm.
normal flexibility that we
Mm-hmm.
hardly do. And even in standing, it's useful, but in sitting, when you want to get closer to the computer, it's a great thing, and especially for fusion. So you have a wonderful chair that just makes that happen for you.
Yeah,
So
let's just
let's
show
point
our
to that
listeners,
chair
our
and show
viewers, the chair I was using, a stool about 1.5 times the height of a chair. And I will say that's a huge improvement over using a chair for all kinds of reasons. But ta-da, the special active sitting chair designed by Dr. Turner Osler, who has kindly given me one of these.
Robert, hold
Um,
that up again. Could you just hold it up?
yeah.
Yeah. And see how when you move it, see how the bottom swings? It's kind of like what you did.
Uh-huh.
Yes. You can see that
Yep.
movement in that. That chair makes that happen.
Yeah, it's
Yes.
a very clever mechanism that allows, I mean, if I sit on it, I can do a lot of movement if I choose to, sideways or forward. Most of the time when I'm using it, I'm not particularly aware of the fact that there is always a little bit of movement there.
Go ahead and tilt the screen just a little down.
Oh,
Just
yeah.
on.
Yep.
Yeah, there.
Yeah. So to do the thing you just suggested, I can do that much. It almost happens from the chair itself.
Yes, exactly. You get
So,
pressed in the screen and just that tilt happens, so your lumbar spine's just really easy and swings and your legs change with it. Yeah, so if you want to think, well, what is that on? Oh, where is that little
yeah.
thing to click on? this all supports itself instead of, where is that? Oh, I can't tell. See how you end up bending, compressing
Because
here.
I
So
could get quite a bit closer to the screen if I wanted to by doing that. And
yeah, and then your legs are still supporting your
they're
trunk,
still
and the chair is
supported. Yep.
supporting your thighs and hips.
Yep.
But you're getting that freedom on your lumbar spine, which I think you can feel if you put a hand
Yeah,
back.
I know. I can definitely feel the movement there. And as I said in our earlier conversation, the big change I notice about using this chair versus the stool is what happens when I get up and walk, and go for a walk or do some other activity. I'm just more easily upright, just without even any Alexander self-directing or anything like that. Just it's kind of a remarkable difference. Um, the other thing I will say about this chair that's really nice is that while it does have a lot of movement possibilities, um, somehow it isn't actually all that precarious once you get used to it, and it doesn't take much time to get used to. Like, I don't feel like I'm in any danger of falling off. Whereas some chairs that I've played around with that had kind of cushions on them with air, air-filled cushions, that was a little phase back in the day. I was always on the edge of falling off. This doesn't seem to quite have that effect. So,
Yeah,
yeah,
and so that thing that makes you feel more upright when you stand up is that freedom in
exactly.
your
Yeah,
lumbar spine and how that works with your leg joints.
right.
Yeah. And then on that chair, if you're sitting on that chair, that just kind of happens as you go forward. So your whole
Exactly.
self can easily go forward, although you're not sliding off the seat. It's just that the seat's
Right. No, there's no sliding on this of me relative to the seat, really. Yeah.
and I bet then, we don't need to do this now, but if you go back then to the regular stool, you can, oh yeah, I can have that movement there, just like
Yeah.
you discovered with standing. It's great to
Right.
have that chair, but if you're at home without that chair and you don't want to get this pressure,
Yep.
then easily you can just, oh yeah, that just, it's not, again, it's not arching or using the muscles of the lumbar spine. It's just the freedom in the bones, in the joints that goes through from the lumbar spine down. It's not just the lumbar spine, it's the whole thing in your body
Mhm.
that lets your balance change as you lean forward in your lower body as well as in your upper body, not just the muscles having to brace more for that balance. It lets everything shift with that. And then your lumbar spine's freer like it is now, just when you're sitting. Even with breathing, there's a little bit of change in the
Mhm.
lumbar,
Mhm.
hips and knees and ankles. So, yeah, that's great. And then that really supports this area, and there's not a temptation to bend forward, bend your neck forward and down from here to see or to
Right.
do something.
Right.
So it's an
Oh,
important thing whether you have the chair or not. The chair is wonderful for it, but just
the chair
something.
enhances it. You can certainly do it with a stool or a regular chair, but I I think this chair certainly makes it um,
It'll just
almost
happen with
hard.
that
It
chair, and then
really
you
just
know what
kind
it
of
is.
happens.
Yeah,
Yeah.
you get used to that freedom. Yes.
So, shall we end our this video?
This would be a good place to end it.
Well, thank you, Eileen.